The following short video provides an overview of how a proton-computed tomography image is acquired. Proton-computed tomography is abbreviated as pCT, that is lowercase p, capital C, and T. Imagine that the patient has a brain tumor. Only a pCT scan can tell us how to treat the tumor while sparing as much of the surrounding brain cells as possible. This is due to the range uncertainty issue discussed on our website. Using a low-intensity proton beam available at proton treatment centers, we can obtain a pCT scan of the area around the tumor. In standard CT or MRI scans, the patient remains still while the scanning system rotates around the patient. In pCT scans, the scanning system remains still while the patient is rotated. This is because proton systems are quite large and heavy. The patient is positioned between the proton accelerator and the detector. For the sake of simplicity, only the beam outlet, known as the nozzle, is shown. The dish-shaped detector is shown on the right. A robotic chair or bed rotates the patient. The blue line transiting the patient's head represents a beam of protons. The detector measures the protons after they pass through the patient. In actual practice, the beam will spread out slightly as it passes through the patient. We have not shown this to avoid missing the forest for the trees. To create a full scan, we need multiple beams entering from around the patient. To better illustrate how the image is acquired, we transition to a top-down view. As the patient is rotated, new beams are sent in while the data from the old beams is being recorded. The new beams are shown here in bright blue, while the older beams fade away. This process is continued until the patient completes a full circle. A single circle of beams scans one slice through the head. The data is organized in a mathematical grid. To obtain a full image, we need to stack the slices, one on the next. This is illustrated by the grid moving down through the patient. In this video, a highly simplified beam pattern is illustrated. In reality, a complex beam pattern will be used. This pattern will ensure that an equal number of protons pass through each little cube of the grid. Each scan will have uniform clarity and a consistent level of detail. As with any medical imaging method, it is important to limit the patient's exposure to the imaging radiation, which our beam pattern achieves. The data from all the slices is processed by our proprietary algorithm to create the 3D pCT image. Each voxel, that is 1 millimeter cube, is assigned a number. This number reflects how much the tissue in that voxel tends to slow down a fast-moving proton. Just as with conventional CT, these numbers can be converted into a grayscale image. The grayscale image is then colorized to highlight the different tissue types, such as bone and brain cells. The pCT image is input into a treatment planning program. For the first time, treatment planning programs will be able to overcome the range uncertainty issue with an apples-to-apples solution. The patient is imaged with protons and treated with protons. Thank you for your attention.